Have you ever heard someone call communication just a soft skill in medicine? Well, for an Indian medical graduate, that could not be further from the truth. Communication is an essential clinical competency that sits right alongside medical expertise. Let us break down 10 reasons why. First, it helps doctors obtain accurate clinical information. A good diagnosis depends heavily on good history-taking, eliciting symptoms, and navigating sensitive topics, which reduces diagnostic errors. Second, it builds a therapeutic relationship. When patients feel heard, it builds the trust, rapport, and empathy needed, especially in chronic illness and psychiatry. Third, communication improves patient safety. Communication failures often lead to medical errors, so giving clear instructions, verifying understanding, and ensuring safe handovers is critical. Fourth, it enables shared decision-making. Medicine today is patient-centered. Doctors must explain diagnoses clearly, discuss risks, and respect patient autonomy for true informed consent. Fifth, it improves treatment adherence. When patients fully understand their illness and why a treatment is needed, they are far more likely to stick to it, leading to better long-term disease control. Sixth, it allows doctors to work effectively within a multidisciplinary healthcare team. Communicating well with nurses, pharmacists, and other specialists greatly improves the coordination and continuity of care. Seventh, it is exactly how doctors demonstrate professionalism and ethics. Maintaining confidentiality, delivering bad news compassionately, and resolving conflicts are often how a doctor's professionalism is judged, sometimes even more than technical competence. Eighth, it promotes health and prevents disease. Doctors are educators who must effectively give preventive advice, vaccination counseling, and screening recommendations to improve overall community health. Ninth, it addresses India's incredible socio-cultural diversity. Doctors care for patients with diverse languages, literacy levels, and cultural beliefs, meaning they must adapt their communication to ensure equitable and respectful care. Finally, number 10, it reduces medical legal risk. Many legal disputes actually arise from communication failures, not technical ones. Clear communication sets realistic expectations, documents discussions, and preserves trust even when outcomes are unfavorable. The bottom line is that communication is not merely speaking effectively. It is the ability to collaborate, gather and share accurate information, and deliver safe, ethical, and patient-centered care. That is exactly why frameworks like the National Medical Commission and CanMeds recognize it as a fundamental requirement for every single physician.